Welcome to Security Heroes, a podcast by Athena Security. We share real-life stories to help connect you to real heroes in the security world. I am your host, Lisa Falzone. Warning, the following recording contains potentially disturbing content. Listener discretion advised. Joining me today is Thomas Smith, President of Healthcare Security Consultants. Thomas has held leadership positions in healthcare facilities such as community hospitals, inner city medical centers, and a large teaching university-based healthcare system. He is experienced in different models of security such as contract, proprietary, and campus security. Thomas is the past president of International Association for Healthcare Security and Safety. Welcome, Thomas.
Thank you.
So great to have you, Thomas. Can you share a behind-the-scenes moment in your career that presented a significant security challenge or dilemma, and how did you navigate through?
Gosh, I have a number of those incidents, and it's hard to narrow it down to one. But there are some similarities with the way we manage the situations. In my career, I've dealt with murder-suicides on my campuses, dealt with an infant abduction before infant abduction was really on anyone's radar, and very massive regulatory issues with the healthcare organization I worked for. And I think the key, and also major snow emergencies where I'm in North Carolina, and the organization I work for here in North Carolina, we're not used to snow, but we got a 20-inch snow and stayed for 9 days. And emergency management is an area, helping manage emergency situations is there are some common themes I think that will help people. And I know in a number of these questions I'll be saying similar things, but knowing who your audience is, knowing who the players are, have previous very good working relationships established with the important areas that you're going to be dealing with: senior administration, the legal department, the emergency department, local law enforcement. Having those well-established relationships in advance is critically important for when you're managing an emergency situation. But again, the murder-suicide is a situation that you hope not to have to experience something like that in your career. But I'm old, I have to say. I've had a number of experiences that I'd rather not have had, but I think it helped to mold me to be a better leader moving forward after we recovered from the shock and after the recovery of the emotional events that you go through, having had experienced one of those situations, or an infant abduction, very similar. Those kinds of situations aren't unique. The response is similar when you have incident activities like this. So that said, that's kind of my areas of major incident activities that we've experienced that come to mind. Regulatory agencies, when your department, if you're in security or one of these areas where one of the regulators is the CMS, particularly if the CMS is in there doing an investigation in your organization, and the person responsible for security has had some involvement. If your department's involved in the investigation, you have to have those pre-established relationships established and have a working knowledge of what are the requirements. Certainly the requirements in your department, you have to have those in advance and know what is supposed to happen. And when there's an investigation, know in advance how are you going to handle it? What information do you share? What don't you share? Organizations handle regulatory investigations differently. And sometimes the security manager may not know what the organization's stance is. And if you're in it, it's too late. You need to know those things in advance. So that's where I'm coming from with major events that have impacted my career.
Yeah, no, thanks for sharing. What do you mean by CMS exactly?
The Center for Medicare and Medicaid Services, they're the folks that pay. It's the government agency that pays and reimburses hospitals. And they have a great deal of impact on security operations, and medical care, and lots of different things. And so they can, if they come in and threaten to remove payment,
right.
For many facilities, 75 to 90% of their revenue, their payments come from the federal government in the U.S.
Right.
And if they're talking about, hey, um, we're gonna, not pay you unless you fix this issue to our satisfaction. It will get your attention quickly.
And they threaten not to pay because of security issues or standards?
Well, what happens if they find a security related issue? So for example, if excessive use of force is used with a patient restraint or inappropriate, what they deem to be an inappropriate act, then they think, well, if we have problems in the security area, maybe we have problems everywhere. So then they
Right.
do deep dive surveys in many areas.
Interesting.
It costs hospitals hundreds of thousands of dollars when to follow up and respond to these investigations in some cases.
Yeah. All
Patient
right.
restraint,
Well,
elopement, use of force, delay of treatment. If a
right.
patient delayed from entering the facility, those are the kind of things that typically get security, people with responsibility for security that can get us in trouble.
What have they made as far as suggestions for you and security teams?
The CMS,
Yeah.
well, they don't tend to tell you, they want you to have a corrective action plan. They'll tell
Right.
you what you can't, they'll tell you what you can't do, not necessarily what you can do until it causes a problem. And I don't want to sound like I'm anti-CMS. There are reasons for
Right.
these laws and regulations, but I'll just use it's an older one, but handcuffing. Security departments, essentially, you cannot, I've been told by the CMS directly, you cannot ever handcuff a patient. And many departments do use handcuffs, and there are circumstances when if there's an immediate life and limb jeopardy situation, some departments will use handcuffs.
Right.
But the specific regulation speaks to metal shackling. So there are other devices that are used in those cases to reduce the likelihood of a CMS survey and putting your organization in immediate jeopardy. I know I'm going a little bit far afield here, but when you have one of those investigations targeting your department, it's it can be very traumatizing for the whole organization.
Yeah, I imagine it's very stressful. So thanks for explaining that.
Sure.
So tell me about one or two heroic actions that you've done or someone on your team has done to save people's lives.
The thing that most comes to mind in my organization, there are many heroes, but I'll give you several examples. Fires. I've
Mm.
had staff been responsible for designing security features into facilities for years and years. Have been happy and been able to participate in designing security into new facilities, but we've had literally billions of dollars of new construction and renovation projects during my time working as an in-house manager. And contractors are somewhat on my radar of people that are dangerous in the facility. They don't follow the fire safety rules. In many cases, not everybody. There are really great contractors that I want to throw anybody else, the whole group's under the bus. But we had a fire in one of our new facilities that was under construction. It was I think it
Mhm.
was a 9-story hospital, and that would have a number of behavioral health units, neurosciences, and emergency department, and a contractor was working on the weekend. They didn't have the appropriate measures in place. And so in those facilities under construction, there's not fire smoke alarms, there's not there's not the detection equipment that you would expect in completed facilities. But big fire happens, security team goes over and is in the middle of fighting a major fire while they're waiting for the fire department to show up. And what was the first example comes to mind when people putting their lives on the line, in a fire under a construction site, and there are very few other people around. The
Right.
security team, the police team on site, they're pretty much responsible for responding and assisting until things are managed. Other examples would include corrections incidents where we had a prisoner's attempting to escape. He overpowered the guard that was watching him in an ICU, took the guard's gun, and was trying to escape by using the officer's gun. Shots were fired in the ICU. Responding officers responded to those situations. Those folks were heroes in my mind as well.
Yeah, definitely.
It's not a life and limb thing, but I think volunteer people who volunteer in professional organizations and put their own time in, and hours and hours and hours of time for the benefit of the industry and other healthcare security professionals. I think those folks are heroes as well, because it's, again, you get out of it what you put into it, but it takes a tremendous amount of effort and time away from family and your normal work environment.
Yeah, totally. So speaking of which, you recently got IAHSS Innovation Award, correct?
I did.
Yeah, can you just tell me what that means
Yeah.
to you and how you got it, and tell me some about some innovation?
Well, the IAHSS Foundation has established this award.
Mm,
I think it was previously a Life Works award, and they tweaked it a little bit last year. But it was for, I believe it was for my work involved in, other people have to nominate you for it, and then the foundation votes on it. But it was primarily my work involved with establishing the guidelines process that we have now, participating in that, suggesting that we have guidelines, and development of what are now operational guidelines and design guidelines for healthcare facilities. So certainly I didn't do it alone. I participated in it when I was president. We were in the process of evaluating the position statements the organization had, and essentially during my time as president and on the guidelines council, we established those. We changed from position statement to guidelines, and that's still in place today. The design guidelines happened maybe 7-8 years after the operational guidelines had been established, and I was instrumental in gaining funding for the development of design guidelines for healthcare facilities. It goes back to my experience with an organization that was designing and building millions and millions and millions of dollars of new facilities and renovating facilities. And I kept seeing some of the mistakes that were just baked into these facilities. And I always say now that security begins in design, and resolve a lot of issues in the long term if things are designed in, or security features are baked into the facility from the beginning. It's always much more expensive to renovate once the facility's up than to build it in the first place. So I think it was some of that, the number of years and the number of the effort that went into the design guidelines. I think that was primarily what it was about in the long term.
yeah,
Support for the association.
yeah, awesome. So how do you go about like creating guidelines? Did you do it with like a group, or how did you?
Yeah, it's
Yeah,
the design, the guidelines council of the association's got, there's a council. The council kind of looks at every year,
right,
hearing what's hot, what are the hot topics in the industry, and then the guidelines. It's certainly not me that develops them. I was part of the team that developed operational guidelines until last year.
right.
I think I was on it from the very beginning. So it's been about 13, 14 years. And I'm certainly still on the design guidelines development process. We're updating those now. But it's a team. Normally somebody's assigned to, write first draft, and then it's brought before the council. And once you get it to an area that you think it's reasonable, then we ask for input from the membership.
Yeah,
I think there are two out there right now. One is metal screening systems. Metal screening is one of those guidelines that's out already or nearly out. The operational aspects of metal screening. I think I saw one recently. K9 is also another very hot topic for organizations. Metal screening. Behavioral response teams are another interesting, not a new topic, but it's a new guideline out there in the last year or so. So
sure.
those are examples.
So where would people go to find these guidelines?
Members of the IHSS will see those on the website. There's a
Yep,
specific area to pull those up. And as a guideline is in development, there's a link is sent out to the membership asking for their input.
right.
And that's an opportunity for members to give thumbs up, thumbs down, give suggestions. having recently left the council, I always like to chip in there and give them a hard time when I find something, something in there that I can pick up the council about. But no,
Sure.
it's a process for gaining input from the membership.
Yeah.
Some of those, I think, typically there's a few of them that are out and open source for non-members to look at. Copies of the guidelines can be purchased from the association as well in a booklet form. But the best way is to become a member, and then you get free access to the guidelines online. I think the design guidelines, there's a small fee for the design
Right.
guidelines booklets.
So talk to me about what technologies you're excited about. What new tech you're excited about?
Well, I'm not a big deep dive technical person. Traditionally, when my business, I'm a security consultant, and organizations have me come in and evaluate security programs. But I have a technical person that does that aspect of the business. I'm more operational, but the technology that I'm saying for long term, the detailed camera pictures that are now available can lead to video identification of people, as well as my dream that we have our, organizations I worked with, we had a trespass list of people that have been trespassed, or people that had been violent in the past. And I would always have loved to have when that person walks back into the organization, I'd say like somebody in the camera dispatch center would, something would pop up and we'd be able to assist that person through the facility where necessary, or ask them to leave if they've been trespassed. But that's now reality. Um, there are those systems available. I think metal screening is another system that's been around a long time. I was an early adopter at a hospital I worked in Michigan, gosh, back in the 80s. We developed, we put one of the first metal screening systems into the emergency department, and now metal screening. Many of my customers are installing metal screening on every public entrance. Certainly behavioral health units, but it wasn't always as acceptable. Was going back into the early 80s, when you start talking metal screening, people will say, well, our patients and visitors will think we're in a high crime area, or they'll think that we have a crime problem here in our organization. What's the hospital across the town doing? Well, now it's the hospital across town has a metal screening system, and two others in the immediate vicinity have a metal screening system. And then you're having your employees in the emergency department and other areas saying, gosh, why don't we have one? So it's become much more acceptable to senior leaders. What I'd love to see is more data, more information about how do patients and visitors feel. And I always, whenever I'm involved in a system that's being installed and being asked to help consult and help develop policies and procedures, I always say, well, gosh, let me do a survey, a pre-survey of how do patients feel about being safe, and then a post-survey once the metal screening system is in place. And I normally, when those systems are being put in, there's a sense of urgency and they want it done soon. It's more difficult to get surveys done. So I would implore organizations to give some thought to a pre and post survey, and that will help. Again, many administrators think, gosh, put a metal screening system in and we're going to, our patients and visitors will think we have a crime problem. Well, sit in their emergency department at 2 o'clock in the morning, and patients and visitors are going to feel pretty good, feel safer, in my opinion, if everyone's gone through metal screening.
No, I totally agree. I mean, a lot of people think that there's going to be this backlash, and it's usually the exact opposite from what we've seen.
What's that?
Yeah. So you mentioned earlier infant abduction. Can you talk a bit about that? I mean, I know it was big in the 80s. I remember my mom was worried, made my dad follow me to the, when I was born, to the doctors. And I know that was big in the 80s, but can you just talk to me about that and how you've seen technology help prevent that?
I am old now, go back to the 80s. We had an infant abduction at the facility I worked at in Michigan, and it was before the National Center for Missing and Exploited Children did not have their guidelines out. It was not something that was really looked at very closely. we had an incident, and I think the physical target hardening had been done in most hospitals. Many hospitals have um, uh, infant screening systems, infant tagging systems.
Right.
They're more and more, I don't want to say inexpensive, but they're more and more utilized. But not everyone has one. It just depends on their individual circumstances. But I think target hardening has occurred. There are fewer infant abductions than there were. There were
Right.
never there were never a bunch of these things. I think maybe 15 to 18 a year were happening in the 80s. I think that would have been a really high year. Now it's much reduced. I don't have the numbers off the top of my head, but it's pushed the infant abductions off campus.
Hmm.
Other areas, the home, infant abductions are occurring there. Infant abductions are occurring in other locations where moms have either befriended people or people have become aware of their circumstance and donating clothes or um, there are lots of reasons, but hospitals have target hardened to a great degree and reduced the potential for infant abductions. Now, infants don't always land, if you're in the hospital, they don't always land uh, uh, in the mother baby unit. Sometimes they're in other areas. So many hospitals have expanded their infant protection to other units of the hospital where they have infants. But that's an area of continuing concern.
Right.
Workplace violence and metal screening are, in the 80s and 90s, all hospital security administrators were rushing around trying to get infant protection systems in, and now it's weapons detection, it's workplace violence. People are scrambling to evaluate should they or shouldn't they. Gosh, if I'm in a low crime situation out in the middle of the country, do I need a weapons detection system? Well, I think you look at where the weapons are happening. You really have to take your own individual circumstances and what is your administration willing to and interested in implementing to reduce the probabilities of a weapons incident.
Awesome. Well, thank you so much for your advice. Just in closing, what valuable advice or lessons learned would you impart to those aspiring to lead in the realm of healthcare security?
Well, I think I already mentioned a little bit, but know your audience, know the important players in your organization. Don't be introduced to your CEO during the middle of an incident or your legal department or your senior directors of nursing administration. You need to know those people. You need to have very good working relationships with those folks. Again, it takes time, but I think having really good relationships, have very good policies in place in the pinch, what I call the pinch points for healthcare security, um, weapon screening, incidents, how to manage incidents, who needs to know about an incident. Nothing worse to me. I always hated walking into my facility and the CEO, maybe I'd meet him in the parking lot and they'd say, Tom, what about, I got a report from the nursing director that there was an incident on 3 North again. What was that all about? If I don't know about it, it's trouble.
Right.
Having good information, having really good relationships with those important people, director of nursing, the personnel department, human resources, legal, and the senior leaders. I just can't overemphasize that. You
Sure.
don't want to be introduced to those folks when they're in the middle of a crisis, and you will get one. You'll have a crisis. If you work in healthcare security very long, you're going to have these crises to deal with, and if you don't have those really good pre-existing relationships, it makes it really difficult to recover. Another suggestion I have is don't just stick your head and have blinders on and look at just security. There are other aspects of the healthcare system that you can help with, whether it's parking, and I know people start cringing when I talk about managing parking, but it's an area that many times security can manage effectively. But look for other areas where your expertise can be helpful, not necessarily just in the security realm. I see a lot of people that have blinders on it. So why would I do that? I don't want to take on more headache. But show your value. I think people being able to show their value in advance Because when something happens and maybe one of your employees will make a mistake, they will, if you're seen as a value add person in your department, that will help you recover from those missteps and mistakes that people make in your area of responsibility. It's just I can't overemphasize, don't have those blinders on. The overall looking for how you can contribute to the organization, because inevitably you're going to need those, you're going to need that support from those other areas.
Yeah, team approach. Well, thank you so much for your time. Really appreciate it.
Well, thank you. It was a lot of fun. Appreciate it.
Security Heroes is brought to you by Athena Security. To find out more about Athena Security and how we help save lives through our weapon detection solution, visit www.athena-security.com. And then make sure to search for Security Heroes in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Athena, thanks for listening.